In one day, we arranged for blood tests, which showed an elevated alpha-fetoprotein. So most probably this man has a primary hepatocellular cancer. There's several small satellite lesions, which means smaller lesions around it.
Right.
And they do not want surgery. Chemotherapy does not work very much for hepatocellular cancer, or it's considered experimental, let's say. The patient and their family want to maintain the quality of life of this gentleman,
Right.
who actually is from Moscow. And so I believe they're going to go ahead with radiosurgery. Radiosurgery for hepatocellular cancers in our hands is non-invasive. There's no cutting, no bleeding, no anesthesia. Patient comes in, gets a treatment. Treatment lasts about 15, 20 minutes. And then we follow the patient with blood tests like cancer markers, alpha-fetoprotein and others.
Right.
We follow them with PET scans, and the success rate's 90%, so it's quite high in the area we treat.
Right, and 90%. And also, what was very interesting, I had a chance to talk to this doctor from Brooklyn. He was very impressed because not only just we did everything, we got every single market blood test on the spot in our center. So there was no movement, there was no going to other places, waiting for results.
Right, so it's fantastic.
24 hours.
So that's the Urgent Cancer Consultants at Radiosurgery New York. Our number is 212-CHOICES, 212-CHOICES, to be seen within one business day. Dr. Eisen, can you give your phone number for people who want to speak to you directly?
Yes, they can call me directly at 917-836-8105.
And in Spanish, please?
And in Spanish, para la comunidad en español, 917-836-8105.
Okay, one more time, and then we're going to go to our commercial break.
Okay, 917-836-8105.
Thank you. And now news from the man with the golden voice.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery New York. At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212-CHOICES, 212-CHOICES for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212-CHOICES. 212-CHOICES. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
We're back. Good morning. We're taking your calls. We're really live. We're sitting here in the middle of New York City. We're a couple blocks from our office, Radiosurgery New York.
Bright and early on Saturday morning.
Saturday morning. How can you prove that we're here live?
What can I do? Today's date. I can say today's date.
Well, I'd say if you just have a phone and you want to
That's true.
call
Give us a
us.
call. I promise we'll
call
be
us
here.
up, 800-848-9222. We're on WABC. I have a lot of cases I want to discuss, and unfortunately the hour is getting too close to the end. But there's a lot of things to talk about, and by talking about these things, we can learn from them. So the first is a woman who had lung cancer and actually a lung lymphoma. It started out as a primary lymphoma of the lung. She had chemotherapy and did well. Then the cancer lymphoma spread to the brain. It's in one site in the brain. She's in a hospital in Long Island. There was a discussion among her doctors, me included, and her family, what to do, whether to have chemotherapy, whether to have whole brain radiation, or just to hit the cancer. So I felt that this woman who's in a wheelchair and has pretty poor function, but the family wants treatment, the family wants her to live, would be best served by 5 treatments, radiosurgery would just hit the cancer. Mm-hmm. And this kind of lymphoma usually melts away.
Wow.
And anyway, the family chose to have chemotherapy. They started on one kind of chemotherapy. This is all within the last few weeks. She's now going in kidney failure. Oh. So you can imagine she's about 85 years old. We thought we could hit the tumor and leave her alone and keep her quality of life.
Sure.
They chose chemo, and I think unfortunately she's going in renal failure. They're now trying a different chemotherapy. She's bouncing in and out of kidney failure. And once you have an elderly person in kidney failure, it's a pretty severe situation.
Yeah, sure.
I'm going to take this call from Dave in Rhode Island. David, good morning. Welcome from New York to Rhode Island.
Hey, good morning, Doctor.
How are you
this
today?
morning, sir?
What do you have to tell our listeners? Because I know who you are.
I know who you are. I know that. I just come back from Thailand.
Thailand? What were you doing there? I don't think I want to hear. This is a family show.
I know. No, I went for an elephant ride, and I just
sure. You could get that at the circus in Rhode Island.
and I went parasailing.
Yeah, okay. You could do that in Rhode Island too. What do you want to tell our listeners? You're on the air on WABC, Radiosurgery New York.
No, I love what's happening so far. I mean, doctors up here and even in Boston, they checked me out over 2.5 years ago. They had me checked out, and radiosurgery is, working out fantastic for me.
Now, you've had, let's say, can I talk about your kind of cancer? Is that okay?
Absolutely, sir.
So you've had a melanoma. You're about, how old, 50?
Stage 4.
How old are you, David?
I was 50 years old, 51 when I rediscovered it.
Okay, so you're about, you're a little bit over 50. You had a melanoma actually 23 years ago, right?
23 years ago, I was in the service. I was in Wall Street Army Hospital.
Right, so you had treatment for melanoma. Melanoma is a kind of skin cancer. And for many, many years, it went away, never came back. Now within the last few years, it came back. You've gone to all the great hospitals in America, correct?
Clinic, Barnes in St. Louis, Missouri, Johns Hopkins, places in Boston, Rhode Island. I know there's a lot of people trying to work. The only place I got results was right with the radiosurgery. Okay,
now you had melanoma. You had about 4 areas treated with us over the last couple of years, right?
Yeah, stage 4.
For stage 4 melanoma, 50-year-old man. So tell us, what happened to those 4 areas that we treated?
Killed every single bit of it. Every bit of tumor that I showed is killed.
Now, not far from you was Ted Williams. Ted Williams batted 400, and he was the pinnacle in baseball.
That's right.
Right now, in you, we're batting what?
Almost 1,000. What
do you mean almost 1,000? We hit everything we've hit.
Don't be bashful, Dave. It's 1,000.
It's 1,000 without.
Now, you've had some chemotherapy simultaneously, so compare the chemotherapy to the radiosurgery.
Well, the chemotherapy was a customized approach, extremely good approach. I told you, when I was getting treated, there's one doctor I'm using in Rhode Island. He traveled, worked upstate in Poughkeepsie for a while. He's back in Rhode Island, southern Rhode Island.
He's a good doctor. He actually sends patients now to us because of you, because he saw the great results in you, right?
Yes, he's ecstatic. His words were, and this was a total independent decision. I went for my PET scan from him originally after my first, round of radiosurgery. But he's been an oncologist for 15 years. He's very up and coming, but he loves, what your people are doing.
Now, David, so in melanoma, you had radiosurgery. Tell people what it's like to have radiosurgery. What do you feel? Is there pain, suffering, cutting, bleeding, hospitalization? What do you feel during the treatment?
Absolutely no pain whatsoever. Maybe a little tingliness at the most.
Tingling? What tingling?
It's the cancer being killed.
Like a ticklish.
Yeah, okay. So was there any pain or suffering?
Absolutely not.
How long did the treatment take?
Oh, I'm a table. I had a lot of areas.
But each treatment, how long did each treatment take?
About 10 15 minutes.
And there were 5 treatments per area, right?
5 treatments per area, about 15 minutes. Some areas can hit simultaneously, and some, you go
right. Some we did 2 for 1.
Yeah, 2 for 1. But I know there's a couple copycats out there. We don't have to mention.
Well, it's okay, copycat. That imitation is the most sincerest form of flattery, right?
That's very true.
Well, the thing is,
if they weren't copying me, I'd be doing something wrong.
Well, the thing is, they're trying to reinvent the wheel. I mean,
yeah, but they can't copy. Look, we have the biggest experience. We've treated 20,000 patients over 25 years. So they can't copy that experience. And ultimately, like the other patient who had tomotherapy, I didn't even talk about the girl, they couldn't treat her with tomotherapy because the tumor was too big. So she's at a big university hospital, all the treatments in one plane. They couldn't treat it because of the size. We're able to be flexible and treat small as well as large tumors. And some of your new tumors were just discovered, and they're very, very small. So you have 2 tumors. 2 tumors we're going to be treating soon in the leg, and 1 in the pelvis, right?
Yes, and I know we're going to get success. The thing is, what I want to say about going to the clinic too. You folks down there help me to focus. I mean, it helps me every time. Instead of going to a lot of these places, they give you bad prognosis, doom and gloom. I get focused, and it's a very good.
What do you mean by that, David?
Well, it keeps me focused on what we're doing. And it's my morale. Morale is always high. Like I was in Thailand for almost a month, and I really miss the people. I really sincerely miss the people because of just what they do for my morale when I'm down at the clinic there.
Well, that's because you're someone special. Every patient is special. We're starting up an urgent cancer consultant so that people who need to be seen within 24 hours, we guarantee them they'll be seen within 1 business day, because we think that there's a lot of people out there that don't understand that you can get a second opinion.
I love the approach because, like I said, again, the doctor here in Rhode Island is so happy with what's going on. And the nice thing about it is, you folks down here bring him is you never stick your nose in there and say, well, no doctor's worth anything. You bring him in on a team. He comes on a team.
Well, that's because everyone's important. David, we're at the end of the hour, but you can call us back if you want on WOR tomorrow. We have 2 shows tomorrow on WOR, which is 7:10 on the radio. One is from 6 to 7 a.m. and one is 9 to 10 p.m. Thank you, Dave. I appreciate your comments very much. Hope you call tomorrow. If you have questions, call us during the week at 212-CHOICES, 212-246-4237. Again, 212-246-4237. And we're promise to see you within 1 business day. So thank you, and God bless you. Have a great week. Thank you, John.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
This is where New York comes to talk. Legendary 77 WABC, New York, a Cumulus station.
From ABC News. I'm Dave Packer. Answers to the question of why a man started shooting in Los Angeles airport might be found in a note 23-year-old suspect Paul Ciancia left behind.
We do know a little bit more about this letter that they found. Not only did it say that he expected to die at the end, but also it said that it had anti-government messages written inside, and it was signed NW.